Thanks, Helen. I invite everybody to read the full report because, as you know, we have just a short time up here, and I could talk about it for the rest of the day. So the project I had the pleasure of working on with PCOH was investigating school-based oral health dental programs in Pennsylvania. And I want to just start by saying that a school dental program can be any kind of effort that's put toward oral health in schools. It can be education, and it can be all the way up to restorations provided in schools. They're many times done with portable equipment, many times done by mobile units. So there's a variety of kinds of mobile. I'm going to skip around a little bit because I want to start with this. So there's a lot of different kinds of programs that are operating in schools. So before we talk about schools, we have to talk about Pennsylvania's situation. So Pennsylvania is one of 15 states plus the District of Columbia that requires dental screenings for school attendance. And in Pennsylvania, the grades that are affected are school entry, which can be kindergarten or first grade, third grade, and seventh grade. And the difference between Pennsylvania and some of the other states is some of the other states only do one grade. But what's really unique about Pennsylvania is that if a student doesn't get an examination and bring a paper in from their private dentist or their family dentist, the school is actually required to provide the screening for them. And so that is really different than some of the other states. And they can do that in Pennsylvania in two different ways. So every school has a dentist of record, which theoretically is the person who they can call on to come and do the dental screenings. And they also can have two different kinds of programs, but both of these programs need the dentist of record. So one is the Dental Hygiene Services Program. And this is a great situation where the school actually hires a certified school dental hygienist to work in the school and to provide these screening services. Sometimes they're full-time employees, sometimes they're not, so that really varies too. The key here is everything really, really varies. So it's hard to generalize about school programs. The other way it can be done is a mandated dental program, and that's where someone is brought in to do the dental screenings, and a dental hygienist is not employed directly by the school. So how the dental screenings are supposed to work is that children get a dental screening, their parents are informed if there's a problem, they go to a dentist, they find a community dentist, they get their problem fixed, and they establish a dental home, and everything's great, right? We'll talk about it a little bit later, but that's sort of pie in the sky kind of dream that isn't really happening. So in Pennsylvania, then the Department of Health reimburses these are, this is a big program. So the Department of Health reimburses schools for these efforts. And there's a formula that they use, but all in all, in 22-23, which was the latest data I had when we did this program, the reimbursement was nearly $1.4 million. And the system, called School Health Annual Request for Reimbursement System, or SHARS, is not designed for data collection about oral health. It's designed for reimbursement, but I'll tell you a little bit about what we have learned from that. So I decided last night that these were in the wrong order, so that's why I'm popping around here. So we did a project, you could call it a research project, it was more like a fact-finding project, and it had several methods. I started by doing stakeholder interviews and probably interviewed many, many of you in this room. Thank you so much for your information. We also did an online survey of certified school nurses, and we also did in-depth focus groups with school nurses, and then finally, there was a data collection pilot project that was done with 4 school districts about what actually kids are coming to the nurse's office for if it's an oral health problem. So we didn't learn a whole lot new from the Certified School Nurse Survey, but it did reinforce what we thought we already knew, and that is that school nurses encounter a variety of oral health issues. Kids come to the school nurse. Nurses know that there's oral health issues in their student population. And the oral health issues have a significant impact on the school nurses' workload. They have a lot of trouble with follow-up. There's, it's time-consuming, and finding dentists to treat children is very, very difficult. So the most surprising thing in this survey was that 25% of the participating nurses had to call Department of Child and Youth Services because they couldn't get a child care, or the parents weren't getting a child care. The focus groups, I'm going to try to go faster because I got my warning. The focus groups were more in depth, and we learned a little bit more about what's going on in school nurse office about oral health. And one thing that I was really impressed with is certified school nurses are committed to oral health. They are interested, willing, they know how important it is. So this is like an army of people out there that really want to help with this problem. This mandated dental screening program creates work for them throughout the school year. It's not a one and done. They're continuously trying to get these forms from kids and trying to get kids into care. So that's really important to know. And they're not able to do classroom education, and you can read the rest of it there, but in the surveillance, the data pilot collection, I actually invite you to, again, to read the report for the focus group part, because we had a lot of really interesting, insightful quotes that we reported. And then in the oral health surveillance pilot, there's 2 errors on this slide. I apologize greatly. The second bullet, where 13% sought care more than once, it was actually 19%. And then on further down, where it says about the average time spent per student was 5.8 minutes, the range was 1 to 30 minutes, not 1 to 3 minutes. So I apologize for that. So anyway, you can see that here, but what I want to get back to was the SHARS report. And remember, this is reimbursement for services provided. And so what I wanted to show you was the dental health services programs that employ community certified school dental hygienists. There's really very few of them. I think in times past there used to be a lot more. And so the majority go the other direction with a mandated dental program. And if you look at the enrollment of the grades that are impacted versus the number of screenings, you'll see that a lot of screenings are happening. Almost every kid in the DHSP programs is getting a screening. Now, as I said, the point is to get them into care, right? So you can see here that 28 to 34% of the kids had problems that needed follow-up. That's not surprising. That's what we found with the 3rd grade survey a couple years ago. We knew that. But they're supposed to go to the dentist and then bring back a form saying that they went to the dentist. And if you look here, you'll see it's much better in for the dental hygiene services program, but it's still very low. So when we're talking about return on investment, I just want to point out here that you've got $1.4 million and 7,100 kids have proof that they got care. So it really starts from a giant program down to a really small result, data-wise. There is a lot that happened and that isn't reported. The children who bring their form back, the form might say they need treatment, even though they've been to the dentist. If dental hygienists have all filled that out in our offices, like this kid needs a lot of care. And then the ones there are probably many that have been to the dentist and got their treatment plan completed, but don't bring the form back. So it's not a perfect system at all, but this is the data that is available. And then if you move on to prevention services provided, there's very little data available. First of all, we know there's portable and mobile programs all over the state working in schools, but there's no registration central place to find out this information. The system might be fantastic. Most kids might be getting sealants from these programs, we don't know. And then also, the DHSP programs and the MDP programs have the same report form, but they are asked different questions. And so you can see the information that we have on sealants and fluoride in the dental hygiene services program, everything in the MDP is not reported. So there's so while the SHARS data is not designed for data collection on oral health services, it is a missed opportunity to get more data, as you can see here. Another thing I want you to notice here is how few services are reported. Screening education, gigantic numbers. Sealants and fluoride, not so much. And we all know that sealants and fluoride are proven preventive methods. And education's fantastic, screening's good, but not to the effect of sealants and fluoride. So we ended up writing some policy recommendations. And so these are, I could talk all day about these, but the first thing I want to say is that I really think the money spent on the screening program would be better spent tweaked towards sealants and fluoride programs. And I think that the state needs a central location. 33 states in the District of Columbia have a centralized program of helping schools get services in the schools. They don't necessarily deliver them at the state level themselves, but they have a program that's standardized, collects data, does evaluations, ensures quality, and I think that we need something like that here. I do think we need to have some sort of registration for portable and mobile providers. And I say me, I'm not the only one who, contributed to this report, so I apologize for making it sound like it's only me. We can strengthen the oral health workforce by increasing the, there's some barriers to public health dental hygienists or dental hygiene practitioners working in the schools, which I don't have time to go into, but PCOH has a lot of information on, so we could change some of those regulations that are kind of unintended consequences, I think, of some of the recent legislation. And, Medicaid, MCOs, they want to provide services for children, right? That's their mandate, but it's not currently happening very much. So if they could get together with the school-based programs and document the fact that they're getting all these kids care, it would be a benefit for everyone. And see, I have to, what should I say finally to wrap it all up? It's very, education. And many people have said, we're preaching to the choir here, but we need to raise awareness among key stakeholders like educators, school administrators. They often don't realize that there is even a different choice, or what's out there, what works as prevention, so and that's not a very good roundup, but I think I did cover almost everything. I apologize for talking so fast, and I apologize that I didn't get to talk about every single issue, but if you want to, my email was on the front, and I would love to talk to you about it.
Thank you, Corinna.
Thank you.